Interesting conversation with our doctor who's here to talk about pulmonary hypertension. Now, this is something that is not commonly known, but if you do know it, then it means you might have it, because that's most of the times when you will hear it. All right, no fighting in the studio, please, Miss Azura. Miss Azura dropped the TikTok camera. So yeah, if you're on TikTok and you went all haywire for a bit, then you know what happened. Well, anyways, welcome to the studio, Doctor. How are you today?
Good, thank you very much.
It's such a pleasure having you here again. Of course, each time you come in, it's always interesting topics with you. And for our listeners, Dr. Mohd Zhafran Zainal Abidin is a consultant in respiratory and internal medicine, UiTM Private Specialist Center, UPSC. He's here, and we're going to be talking about pulmonary hypertension. Now, we start off with this one, Doctor. What is pulmonary hypertension?
Okay, to begin with, I guess pulmonary hypertension is quite a heavy topic for us to discuss in general, in public. But as usual, we will try to bring the discussion for the audience to understand what is pulmonary hypertension. Pulmonary hypertension, so it's kind of difficult. It's kind of different with the normal, usual hypertension. First of all, we need to understand in our body, in human body, we do have two types of circulations. One is systemic circulations, another one is cardiopulmonary circulations. So if the normal circulations is from your heart towards your general of the body as the other organs and back to the heart. For the pulmonary circulations from the right heart to the lungs to get oxygenized, then go back to the left heart before it being pumped out to the general circulations. So we divided. Let's say we talk about hypertension first. We divide into the essential hypertension, and the other one is more towards the pulmonary hypertension. The essential hypertension is when your heart pump to the general circulation and the blood pressure is high. Okay, that's multiple cause of it.
That is the overall.
Yeah. That's the overall thing that you always talk about. I have hypertension.
Like my father lah, don't want to take medicine.
And a lot of us basically is just like the iceberg phenomenon where we don't know that we do have hypertension.
If you're stressed at work, it's not hypertension. Go get yourself checked up first.
So for pulmonary hypertension, when we talk about pulmonary hypertension, we are talking about from the heart pump, from the right heart pump towards the lung,
right heart towards the lung,
the lung, where we know that in when we study in secondary school, we know that the right heart pump towards the lung, then the lung go through the lung to get oxygenized and go back to the left heart and before it pumping out. So that circulation from the heart towards the lung towards the heart will have some sort of the pressure is a bit high. Why this thing happen is because of those resistance in the lung or because of the heart itself having problem. So in general, even in our populations, it's not our population. In worldwide population, it's only about 1% that the population have pulmonary hypertension, and out of it, 50% we don't know what's the cause of it.
Okay, so essentially 1% out of the people in the world, they're having hypertension. And when you say pulmonary hypertension, it only affects that particular area, which is between the right heart to the lung to the left heart. That's it.
Yeah.
Oh, wow. So this is a very, very niche condition. All right.
Really true.
And what would the symptoms be like?
When we talk about that, so we need to understand. Okay, so when we talk about pulmonary hypertension symptoms, the symptoms is not really specific. We don't really have a specific symptoms. Most of the time the symptoms is overlapping, because we know it's involved the heart, it involved the lung. So anything that give rise in terms of the lung symptoms, such as shortness of breath, anything that can in terms of patient who has reduced effort tolerance, such as previously he can walk for a long distance, suddenly patient will have gradually reduced in terms of the tolerance. Patient who have cough, which is non-resolved cough consistently. Patient who have chest discomfort also will kind have this kind of symptoms also, in view of, because of we know what pulmonary, when we talk about pulmonary hypertension, whether this is the lung issues or this is whether the heart issues or other things. So the symptoms is overlap. So the symptoms is very general. Even lethargy itself is one of the symptoms in terms of pulmonary hypertension. You are feeling very tired, all those things. So it's kind of difficult if one patient come to us say, oh, I have this kind of symptoms. We usually don't say that, oh, you have a pulmonary hypertension.
Yeah.
Because it's a long way to go before we can say, oh, you have a pulmonary hypertension, because it's all need to be investigate before we can say this patient having pulmonary hypertension. But bear in mind, anything which is not resolved or anything chronic, you need to get yourself checked. You need to get yourself to see the doctors. For that, we can investigate you.
All right, so some of the symptoms might be that. There might be also be other reasons behind that and all of it. But you know what? We're going to be coming back. We're going to take a short break. We're going to be listening to one song, I Will Always Love You by Whitney Houston. And yeah, I will always love you even if you have pulmonary hypertension. Well, anyways, we're going to be right back. We are with Dr. Mohd Zhafran, Zainal, Abidin, consultant in respiratory and internal medicine, UiTM Private Specialist Center. We're currently speaking about pulmonary hypertension. We will be right back. Don't go anywhere.